if you have diabetes, it just must be well controlled. And lifestyle, so people who live sedentary lives, obesity, all these things, obesity, diabetes, all those things, it causes an imbalance in testosterone release or androgen release. So there's a lot of testosterone in our blood, in a man's blood, and that can predispose them to having BPH. So what are the signs and symptoms? Please, if you don't listen to anything at all, you should know these signs and symptoms, because a lot of men may probably be having these symptoms and think, oh, it's normal. They are eating some things. They said, oh, so they've gone to buy some concoctions, or there's some particular fruit, so they are doing all sorts of things without going to the hospital. So this is very, very important. These are the signs and symptoms. So we have what we call the storage symptoms, voiding symptoms, and symptoms that occur after urination. So storage symptoms is the bladder is supposed to keep urine. That's what the bladder is supposed to do. And at the right time, it tells your brain that, it's time to pass urine, and then you pass urine. But then what happens in people who have BPHs? They can't store the urine. So they are just there, and then suddenly they are holding. It's like they can't control the urine. And then they are like this, doing the waltz, dancing, and then they have to go to the urine. So that's called urgency. So urgency is when they have the urge. They can't even keep it. So that's urgency. And then they'll rush to the toilet. And when they rush to the toilet, they have voiding symptoms. So they have hesitancy. So now you finally got, you have urgency. You couldn't keep the urine. Those are your storage symptoms. Now you've gotten to the bathroom. Pass the urine, you can't pass the urine. Sometimes when you finish passing, it's like there's still some left. It's very uncomfortable. Or they are ready to pass the urine, but they are hesitating. That's called hesitancy. They are hesitating. But like it's not coming. So that's hesitancy. Or when they are done, they feel like, you see them, they come out of the bathroom and then they are dribbling with urine around. So that's the voiding symptoms. Those are the voiding symptoms. And then symptoms which occur after urination, I've mixed them up. But symptoms which occur after urination, so they are done and they feel like there's still some left. You see the urine around and all that. Okay. So basically, these are the things I've spoken about. So there's also weak stream, because when a man is urinating, the urine is supposed to go at a certain projectile into the toilet bowl. But then they have weak stream, so it doesn't go, so it will just end here instead of going there. So they'll end up messing up the toilets. The urine will be around them. And then frequent urination, you are sitting down, then the least thing, they've gotten up, they are going to the bathroom. In the next 2 minutes, mind you, not everybody who has these symptoms have benign prostatic hyperplasia. Some may be as a result of so many things. Diabetes can also cause frequent urination. Or maybe that's how the person has changed themselves. Some people have changed themselves since childhood, so at least they have to pass urine, empty their bladder frequently. So it's not everybody that you see sitting by you and getting up to go and urinate, then you say, Menele, no, it's not all the time. But these are some of the symptoms that if as a man you are having, you need to give attention to it and go to the hospital immediately before it gets to the point where you now have what we call urinary retention. Next slide, Nikomi. Yes, so the complications. So it gets to the point where you now have urinary retention. You can't keep in urine. You can't pass urine. And trust me, it's one of the most uncomfortable situations to see a man in. At that moment, they'll give you anything. If they have $5 million, they'll give you $5 million to empty that urine because they can't keep it. Imagine for like a whole day, you can't pass urine. It's so painful, so uncomfortable, and they will do anything to have the urine emptied. It should not get to this point. It only gets to this point when you have the signs and symptoms and you do nothing about it. So that's where you have urinary retention. So sometimes when they come, because the prostate has grown and grown and grown and obstructed where they urinate to, that's the urethra, we can't even pass a catheter through the penile wall. So we have to poke into their lower abdomen, poke into it. That's how invasive it is. And then get the urine out from that side so that it goes straight into the bladder. So it shouldn't get to that point, please. And then because of the urinary retention, you're always holding up urine. It can end up in you having urinary tract infections and bladder stones, bladder damage, and then ultimately kidney damage, where you now have to be doing dialysis and all that. So what are some of the tests that we do when someone has BPH? When you go to the hospital, they'll take a history, you'll be examined. As part of the examinations, like I said, they'll do a digital rectal exam. So they'll put a finger into the rectum. Why? Because I said that the prostate is in front of the rectum. So when the prostate becomes big and you put your finger into the anus, you can feel it. You can feel it, and that will tell you. But then in benign prostatic hyperplasia, when it becomes big, it's still smooth. So we know that, oh, this is benign. And then you have to, because of these things I said, it can cause you to have urinary tract infection. So they'll do urine tests, blood tests. And then there are some other tests, you may have heard of it, PSA. There was a time we did a screening here, and we did the PSA, that's prostate-specific antigen. Prostate-specific antigen. So it's just a protein or a substance that your prostate produces. And it's not supposed to be plenty in your blood. So if you check and then it's high, you are likely to have BPH or prostatic cancer, but don't necessarily. And then they also do some other tests. So the treatment is based on, it's not everybody that goes, some people are afraid to go to the hospital because they think they'll do surgery for them. So they won't go to the hospital. Yes, but I know that Theron is not afraid of surgery, right? Right? Yes. So when you go to the hospital, it depends, the treatment will depend on the size of the prostate, how big it is, and then your age. If a 90-year-old man is coming with BPH, we are not going to do any invasive. She's already 90. Why are you going to open up a 90-year-old man to do surgery? We'll let you go in peace. Yes, and then the age. So I've mentioned that, sorry, your overall health, how healthy you are. If you have diseases that are already weakening your immune system, no one will do surgery for you. And then how serious the symptoms are. So, the next slide. So all these things will guide us in what exactly we'll do for you. So if you go to the hospital, so once we examine you and assess you, they'll either put you on some medicines, which you have to be taking daily. And these medicines will shrink the prostate. And then there's also the non-pharmacological one, where they'll tell you, go and lose weight, lifestyle, eat healthy. Those things might just restore your normal hormonal balance, because I said that testosterone is one of the, it's been implicated in the cause of BPH. So they would ask you to do lifestyle modifications. And then ultimately, if nothing works, that's when they'll do surgery. And the surgery is nothing scary. It's nothing scary. So either they'll do it, you'll be fully asleep, or they'll give you spinal, or they'll give you an injection at your back, and then you lie down, and then they put a probe or a tube into your urethra, and then we scrape off the excess tissue, prostate tissue. We just scrape it off. It's like they wash it out. It's called a transurethral prostatectomy. Okay, so prostate cancer, now that's the main reason why we're here. So prostate cancer, so I've spoken about benign prostatic hyperplasia. Benign, like I said, is not cancerous. Then we have the cancerous one, that's the prostate cancer. Now look at the difference between this and the other picture. So the other picture, you saw that the prostate was growing, but it was whole. The whole thing was growing together. We are all growing together. But then in cancer, one cell, everybody is going this way. Then one cell just decide that, let me go, no, they are going the opposite way. That's what happens in cancer, basically. Every cell is going at a certain pace, doing their duties at a certain pace. Then one decides that, no, me, I'll grow this way. And then those ones take over and start multiplying. So that's what happens in cancer. So the DNA, which controls the multiplication of cancer, just suddenly changes. And when it changes, the cells just start multiplying in a haphazard manner, and then they spread from one cell to the other. So that's the red portion that you are seeing right there. So this is also important to know. So about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. So if we count 1, 2, 3, 4, 5, 6, 8, 1 in 8 will be diagnosed of prostate cancer during their lifetime. And then 6 in 10 prostate cancers are diagnosed in men who are 65 years or older. The average number of men who are first diagnosed is about 60 years. The average age, is about 67 years. And prostatic cancer is more common amongst Africans. Some diseases are more common amongst whites, but for some reason, this is common among more Africans. And it's been said that it's more aggressive in Africans as well. Okay, so this is just a picture. So as the prostate is growing, what it does is that when it's growing haphazardly, it will go into the urethra where you pee from. So it blocks or obstructs your urethra. So imagine the urine is supposed to come from the bladder, then something has blocked it. So passing urine is difficult. So it blocks the tract. And then it might grow out to other structures as well. Okay, next slide. It's just a picture. So this guy is asking again, how do we answer? Because I think I've said it. What causes prostate cancer? Anyone? I've mentioned it. How does cancer come about? Anyone? Your cups are waiting. Yes.
It's either a lifestyle or maybe if you have infection, viruses in your system.
Okay, thank you very much. So please use NICAP. But so prostate cancer, like I said, cancer is caused by changes in the cells. And I said that all the cells are going this way. Then some cells decide that they are going the opposite way. So there's the DNA. The DNA, every cell has a DNA, has a technical know-how. So the DNA suddenly changes, and then all the cells replicate or multiply in a different way and spread to other organs. So that's what happens in cancer. It just changes, then everything messes up, and then it starts spreading to all other organs, and all those other organs will also start multiplying the same way. Everybody's doing this, and they are doing this, they are doing this. Some of them multiplies very fast. So prostate cancer in general, that's how cancer happens. So that's what causes prostate cancer. It's just DNA changes, basically. Yeah. So for infections and all that, those ones cause prostatitis. But for prostate cancer, DNA changes, basically. So the risk factors. So, of course, with prostate cancer is the older age. So it's rare for you to find prostate cancer in 40-year-old or below, but then it's possible. But it's more common in older age. Then also, like I said, race. And then if you have a family history of it, there's a gene called the BRCA1 and BRCA2 gene. You don't need to put that in your head. But that gene has been known to cause breast cancer. So if you have a woman in your family who has breast cancer, it puts you at a higher risk of having prostate cancer, and you must check that. And then obesity as well. Okay, so the signs and symptoms are similar to BPH. So it makes it confusing sometimes when the patient comes to the hospital. But they have trouble urinating, they have blood in their urine, blood in the semen, but they will have other symptoms too, like bone pain, because the prostate can spread to the bone. And then they start losing weight. They are eating everything, but they are just losing weight. And then there's also erectile dysfunction. So same thing, when you go to the hospital, they'll do a digital rectal exam and then a prostate-specific antigen test, and it might be high. So this is how we do the DRE. Sometimes you have to bend or lie to your side, and then we do the digital rectal exam. So the diagnostic tests are ultrasound. So this is a special ultrasound where the tube is passed through your rectum. So the scan, the scan that we do, the one that they put on the abdomen, you can do different scans. We have one you do on the head, one you do to the vagina. There's also one that you pass the probe through the rectum, because that's how you can see the prostate very well, because the prostate is in front of the rectum. So you pass the probe through the rectum, and then you can view it. They may ask you to do an MRI, or they'll do a biopsy. They'll take portions of the prostate and take it to the lab and test and look at it under a microscope and see what is causing it, if it's really prostate cancer. So this is the ultrasound. The man is lying, the first picture, lying on the side, and the probe has been inserted into the anus, and then he's doing a scan and viewing it on the screen there. And then that is the biopsy. So they use something to, the right side is the biopsy. Yes. Okay. So every cancer has stages. Usually, there are 4 stages: stage 1, stage 2, stage 3, stage 4. So usually when someone has cancer at stage 1, it's localized to one place. It hasn't spread. It's in one small corner. Then it starts spreading. So first it's in one small space. Then in the second stage, it starts spreading to the urethra. Then in the third stage, it starts spreading to what we call the lymph nodes. Then the fourth stage, it starts spreading to other organs. And that one, sometimes you may need chemotherapy or what we call palliative treatments, where we are only making you comfortable as you exit this world. Okay. So the treatments. So the treatment of prostate cancer is more invasive. Unlike the BPH that you go, they can just give you medicine and all that. Please, there's no food. There's no particular food, maybe yam or something, that when you take, it will take prostate cancer away. There's no food. Studies have shown that there's no particular food. Some will say, oh, when they bought this and they ate it, it went away. So the person is like judiciously taking that particular food. There's no food. The treatment is invasive and you don't have time. So when you lose time, you get to a stage 4 when nothing can be done and you are just going to be helped beautifully to go away, to exit beautifully. It doesn't have to get to that. It doesn't have to get to that. So the treatment is surgical. And like I said, the Ethereans should not be afraid of surgery. So the first thing that we can do is surgery. Surgery is not a big deal like people make it seem. You should ask yourself that so many people have done surgery. 1,001 people have done this surgery. So why will you be the one to go? And if you are the one, then that is what life wants for you, because you cannot resist exiting. So when it's time and your way to exit is through surgery, then so be it. But rarely does that happen. We've done 1,000,001 of these surgeries and it hasn't happened. So why would that happen to you? So please, if a doctor says, I have to do surgery, don't say you won't do surgery and go and find other ways and means of doing it and come back in a state where nothing can be done for you. Okay, so that's the first thing. So surgery. So the surgery, they can even take out the whole prostate. You can live without your prostate. So if it comes to cancer, they can quickly take out your whole prostate. So it's called a prostatectomy, or they can do a radical prostatectomy. And then there's also radiation. So radiation, they'll pass some rays through your body. You lie on a machine like this, and then they'll pass some rays through the body to burn those tumor cells. So that's the external beam. So they pass the radiation from outside. Then we also have the other one that you are lying down and then they'll put something through your anus and then the radiations will hit directly onto the prostate. That's called brachytherapy. You don't need to put the names in your head. So that one, it targets directly the cells. They may do all these things for you when you go to the oncology unit. So the oncology unit is the cancer unit. And if all those things have failed, they'll do chemotherapy, they'll put you on some medications. Sometimes they'll be doing it concurrently with some of these other treatments that I've mentioned, chemotherapy and hormone therapy. Okay, so basically that's it. And at the end of the day, it affects the psychological health of a man. I'm very, very passionate about psychological health. Every time I'm managing a patient, I consider that as well. Because at the end of the day, you spend so much money, especially when you don't go to the hospital early. Because when you go to the hospital early, it's just a few drugs that you have to take, and then you are fine. But when you don't go to the hospital early, you end up spending so much money. It causes financial stress. It causes a man depression, anxiety. They don't have sexual satisfaction. They are not happy in their homes. And all this goes on, and it's like a conundrum of events, and it makes the man unhappy. But then I know that today, together as a collective force, we are all deciding that we're going to do, as a man, you're going to do your prostate-specific antigen test. I mentioned that earlier. So it's a screening test. So you do it regularly every 6 months. You just go as part of every person, as part of your routine examination, you should do your prostate-specific antigen test. You just go to the lab and ask for a PSA to be included in the test. So you do your PSAs. If it's high, immediately report to a doctor who will then refer you to a urologist. Thank you so much for your attention. Okay, thank you so much. So we've had the first part of the session, and so if you have questions, kindly put them down. And as I said earlier, Dr. J is going to take us through the general health topics, diabetes, hypertension, and so he's going to start, and then once we are done, you kindly ask as many questions as you want. Thank you so much. So I welcome Dr. J. Thank you.
Good morning. Good morning. God bless you. God bless you. We are very grateful to Nadi for such a wonderful academic lecture that dealt into all the aspects of prostate infection and then neoplastic aspect of the prostate, that's prostate cancer. So we are grateful to her. We'll be looking generally at our health. There are things that affect us, that affects majority of the people, not only men, and this would include hypertension, diabetes, and then problem of the spine, which we generally call spondylosis. And as we discuss, these other things may arise, and as they do, we can address them. So we'll be starting. The topic is maintaining our health as we age. Whether you like it or not, you will grow. And as you are growing, the body systems changes. What happens is that when you look at the function either of the central nervous system, the function of the digestive system, the function of the renal system to excrete, all of them, when you plot a graph of the functions or the indicators that measure the functions of this organ, they are supposed to decrease over time in acceptable manner. When they decrease faster than is accepted, then it raises alarm. Then we will need to do one thing or the other to arrest the speed of decline. But whether you like it or not, no matter how good you keep your lifestyle, there will be a decrease. But those decreases will be within acceptable means. So right now, we'll be looking at health. Commonly, we have been talking about what we call the WHO classification of health because it is broad and it touches upon almost everything. So I will be reading it out, and then I'll give you an abridged form, a simplified form also, which I have been using. We say health is a state of complete physical, mental, social well-being, and not merely the absence of disease. So which means that you may be healthy and strong when there's a problem, when there's a problem with your physical, your mental, and your social well-being, your relationship with your boss at work, your relationship with your sibling, your relationship with your spouse, this thing can affect the way you feel, and it can affect your appetite, it can affect how you react to other people. And this, we say, is making you unhealthy in its broad sense. When we look at health, I have come to understand that health is a character. Health is a thinking system, and health is a behavior. Why do I say health is a belief system? What you believe life should be. That how should I live my life? Oh, let me eat whatever I like, do whatever to what extent I'm enjoying. This is your belief system, and this will go a long way to affect your health. So when we do wonderful things like this health talk, that gives you a more insight about health. It goes to change your understanding, and therefore it affects your thinking and your belief system, and it will affect your lifestyle. And in certain diseases, apart from chemical or medical approach, we have lifestyle modification. And this lifestyle modification comes from an acquired knowledge about how disease behave and how they work. So we'll be looking at the common health issues that affect us. Hypertension, diabetes, spondylosis, prostate has already been dealt with, so we won't look at it. And then erectile dysfunction, today being Men's Day, and that is something that lies on the heart of men a lot. So we'll talk briefly. We'll not be going into too details. We'll be looking on the surfaces, and so that we'll be able to look at all of them. So hypertension. Hypertension is a measure of the force with which the heart circulates blood or pumps blood to the various organs to maintain the normal activities of the body. Depending upon the age, there are accepted values. Small children that are born today, babies, have acceptable BPs because their body is small, so the heart should not pump at a higher force. As you grow, BP is supposed to increase to cater for the increase in size of the body as well as the various organs. However, if the increase is faster than what is accepted as norm, then we say, hold on, let's do something and slow down the increase in BP. So we have a machine that checks BP. We call it sphygmomanometer or BP apparatus. And there are ways by which we measure BP. We measure it in the upper arm, though we can measure it at different places, but all those different places have acceptable values that are accepted as norm. So you measure it with the calf at a level that is almost equal to your heart. When you raise it too much, you are going to get a value that is lower, because as you raise it, the amount of force going to the arm at that area will be lower. So you don't check BP when you are standing like this. And when you bring the hand below the heart level, you may get a BP that is higher than what is supposed to be. So we have acceptable level at which we put the BP apparatus to give us the BP value. Normally, because anxiety and other things, especially in hospital, can affect BP, it is always advisable to check the BP at least 2 times. We are now coming to look at what we call acceptable values, but not saying that they must be the values that you get. But these are guidelines on rotation to know that, yes, I have to see the doctor or not. So adults between the age of 18 and 39, you are supposed to have a BP of around 119 or 120/70 for men and 110/68 for women. And then adults from 40 to 59 years, about 124/77 for men and 122/74 for women. These values are the ideal values. When you look at the JNC, that's the Joint National Commission on Hypertension. This is a body that does research to look at the outcomes of high blood pressure. When you talk of outcome, when your BP goes high, it can affect you. And one of the outcomes is that maybe you might get a stroke, you can get a kidney problem, you can have eye problem, etc., etc. So when they do research and things, they realize that for you to be able to enjoy, quote unquote, the God-given age, then you should have the values that are given. But right now, what we take roughly, that if you're an adult from around 35, 40 years going, your BP should not be more than 139/89. 139/89, that is roughly. The ones that I'm giving you are the details for the various ages, but you don't need to remember this. If you're able to keep into your head that your BP is not more than 139/89, then you are good to go, and therefore you don't have a problem. These ones are more academic, and we don't need to bother our minds with them. But if you get a cutoff, the lower the BP, the better, provided it is not associated with other symptoms. You can have somebody whose BP is super normal and it is not good. Because as we grow, the blood vessels tend to become weaker, and then deposition of substances, including cholesterol, block the pathway or the patency of some of the blood vessels. And I normally want to give example of an 82-year lady who has been moving around from hospital to hospital with dizziness, which she is not finding a cure. She has one of the causes of dizziness which she is addressing, that is cervical spondylosis, and she is wearing her neck collar very well. So somebody said that, oh, I have a doctor, I'll bring you to him and he'll be able to solve the problem. So when they brought this lady at age of 82, the blood pressure is all around 105 or so, over 60, and it is normal. She's saying that, oh, my BP, don't worry, there's no problem. But this is what I found. And she is on 3 medications. So advice that I gave her is that let's suspend 2 of the medicines and then come back in 1 week. She comes back and she wants to carry me at her back. You have cured me, you have cured me. Because the BP has gone up to about 140 over 90. And the dizziness and everything has disappeared. So sometimes if you want to follow numbers, you will run into trouble. So this tells you that you may have a BP machine in the house, but it's always advisable to visit the health facility, and such talks, as has been organized, should be able to sensitize us that this thing should not replace medical consultation. We have been giving health education about prostate, we are talking about hypertension, we'll be talking about diabetes. This should only raise your awareness of the need to do periodic checkups. And how advisable it is, if you have not done one before, you can do one anytime from now. But it's always advisable, if the means is there, at least once a year. If you don't have the means, then don't wait more than 2 years if your previous ones are all normal. If your indicators, any of them is not normal, then the doctor will give you an appointment to come to a hospital for follow-up to see whether the intervention, the medicines that we're giving you are working or not working. One of the complications of hypertension include stroke, and stroke means there is a motor deficit. Motor means the movement. Either you are not able to raise your hand well, or you are not going to raise your leg well, and you may have a change in your face, what we call facial palsy. Your face will twist to one side. And sometimes it may have harbingers, things that can alert you that something is going wrong. But we normally don't stress on them because hypertension is symptomless. You may have BP and you may not feel that you have BP, even though there has been associations. When your BP starts going up, you may be lucky to experience headache. But if you are waiting for headache before you think that your BP is gone up, you may be disappointed. Sometimes you may feel uncomfortable. Some people are able to tell. Some of them exactly when they say that, today I feel my BP is gone up. Yes, the BP is gone up. But these things are not reliable because we have not studied them very early, so we have not mastered them. And therefore, they don't form a reliable way by which we can be able to tell whether they've gone up. Luckily for us, medicine has a machine, which we call BP machine, that we can use to tell that our BP is gone up. It is good when you have one in your home, but don't let that one be a disadvantage. Because sometimes you feel that, when I go to the hospital, the doctor will just check the BP and say, go and continue your medicine. But this should not be the case because we have protocols. If you follow up at a clinic between 4 to 6 months, doctor can ask for a full blood count, can ask for cholesterol tests, can ask for kidney function tests, and then it will inform the doctor as to whether to add something or to subtract something or to give you some life modification advice. But when you are checking the BP on your own, you may be taken by surprise, as has happened to a lot of people. So the advice is that despite the fact that you can have a machine in your house, please, at least once a year, or not more than once in 2 years, you should be able to visit the health facility. And you could visit the health facility earlier if you have appointment with the healthcare worker, the doctor or the nurse or the gynecologist. So let's do well to follow. As I was saying, the signs that may be associated with high blood pressure include headaches, shortness of breath, nosebleeds. But these are not exhaustive. Sometimes I don't even like talking about them because some people will wait to see them before they act. So please, let's not wait. Please, you can move on so that they don't. And these are some of the preventive steps that we can take to help us lower our blood pressures. They should not replace the advice that the doctor will give you, but on your own. Physical activity regularly, at least 30 minutes of moderate aerobic exercise such as walking, jogging, or swimming most days of the week. If you can get at least 2 to 3 times a week, if daily, to God be the glory. The issue is that whenever we are exercising, the body mobilizes its strength, it increases the heart rate, blood pressure is increased because the body cells that are moving at greater need more oxygen. And the body's blood pressure may go up during exercise. But when this thing is done regularly, whenever the body is not called upon to exercise and you are resting, the blood pressure becomes normal because the body doesn't see the need to raise itself. So whenever you do regular exercise, it goes a long way to help you get acceptable normal BP. And then maintaining your health. When you increase body weight, the heart is pumped. It's forced to increase its pumping powers so that distribution of blood goes to the increased parts of the body. So obesity or increased body weight is associated with increased blood pressure. So in attempt to reduce blood pressure, one of the practical ways is to work on your weight. And Ethereum Mission has a wonderful procedure, what we call health reset, that helps us to be able to reduce our weight. And in one way or the other, it helps us to reduce blood pressure. During the early times of health reset, 2 members of the church were complaining that they haven't changed the dosage of their medication. They are beginning to feel dizzy and checking their blood pressure is dropping. One of them is even sitting amongst us here. And talking to me, I told him that the only thing that has changed in our life is health reset. And therefore, I think the health reset is positively acting. And therefore, I advise the patient to withhold one of the BP medication, and there was improvement in the person's dizziness that the person was experiencing. So if you are able to keep your weight down, including diets, if you become a regular participant of health reset, it will fulfill the aim of the program. So let's embrace health reset because it will help us. If you take a conscious effort at keeping down what goes into your body, it will go a long way to affect the available energy and therefore will affect your cholesterol, affect your body weight, and then will affect the demand on the heart and other organs to work. When you overeat, you are putting stress on the digestive system, stress on the distributive system, stress on the excretory system, and in short, stress on the whole body. So please, let's embrace health reset. It will go a long way to help us in even, we'll be killing 2 birds with 1 stone. Because these are the same advice that we give with people who have diabetes. So health reset is good that we should try and embrace it. The other advices include reducing salt intake. That is sodium. Sodium is our table salt. That doesn't mean you should not eat salt, but eat salt cleverly. Salt can be inside your food, but you should not be able to feel that there is salt inside. A little salt just to give it a little taste, but not for you to feel that it contains salt. And then potassium works on the heart and helps in reducing blood pressure. Magnesium too as well. Potassium, we normally get them in fresh fruits and vegetables. And then we should limit alcohol or stop it if it's possible. And then we should quit smoking. And then stress management. Here too, a Tyrian Mission is available. Our Saturday exercises by the Total Health Ministry is there for us to help us through the various, formulas that are given, our breathing exercises, the meditations, the yoga, taekwondos. These are forms of isometric exercises that helps to improve circulation. They cause balance within the various systems, including the nervous system. And in looking at disease profile, it seems as if nowadays, even the Westerners are moving towards the Eastern techniques that if you're able to do meditation, exercise, and things, it brings you balance. And this balance helps a long way in almost every sickness, including cancers. So let's embrace the Total Health Ministry so that at least we'll be able, because after listening to the very, very eloquent lectures on prostate, a lot of us would have become frightened, because if you're looking at the numbers 1 in 8, wow. So you are counting 1, 2, 3, 8. Hey, I'm the 8th person. Maybe I'll be the one to be affected. But thank God to a Tyrian Mission. Thank God to the measures that we have. If we adopt them, there is no need to fear. But all the same, that doesn't mean you should not do the checkups, so that if anything is beginning to get out of hand, you can address it very well. Sometimes you can do this ultrasound scanning of the pelvis, and when you do it, you do what we call post-void urinary volume. They will do ultrasound scan of the pelvis, calculate the volume of urine present, calculate the volume and the mass of the prostate. Then immediately after that, you are asked to go to the washroom. Go and urinate. Immediately you finish, come back. And when you come back, we will do what we call post-void residual volume. So how much urine is left? You may not be having any complaint. However, if your amount of residual volume is more than the acceptable one, then you can be giving the necessary advice, which when you take it in good faith, can either delay or prevent the development. Because exercises, especially the ones that involves squatting, that puts training on the muscles of the pelvic floor, etc. No, they don't stop it, but they have been associated. There's a difference between causal and association. There is an associated low level of prostate hypertrophy and cancer with people who do exercise. That doesn't mean that it is a cause. We don't have a causal relationship, but we have an association. And it's not a small association. So if you can be able to eat a disciplined diet, like we've been told, nobody knows the cause of prostate cancer and prostate hypertrophy. But there has been a lot of research. None of them is conclusive, but associations have been established between high levels of fat, high levels of sugars, especially these are artificial sugars, and the levels of prostate problems. So if you can cut them down, probably it will go a long way. And then the eating of antioxidants has also been advised, but they cannot replace the treatment given by a qualified health worker. Next, please. And then regular screening. It's always good. If you have the machine, fine. If you don't have the machine, from time to time, at least once in 3 to 6 months, you can check your blood pressure, and especially if it's around the borderline values like 139, 140 over 90. We are always concerned about the top one, what we call the systolic pressure. However, we can have diastolic pressure when the low part of the BP is normally quoted in 2 values, the systolic, which means the working heart, and then the diastolic, which is the resting heart. And the resting heart, the value should not be more than 89 or 90. So if it is consistently around 95, 100, means that you need to be put on treatment as well. So we should take that one into consideration. Some of the changes that occur in blood vessels as a result of hypertension, and then with or without cholesterol. When you have high blood pressure, it makes the blood vessels to vibrate. They move on and off, and then it is believed that some of the small fibers get broken, and broken fibers trigger what we call clotting cascade. Because when something cuts you, nature has a way of making sure that you don't bleed to death. This is what we call the clotting cascade. And when a small intravascular damage occurs, then a small clot can form, which will be the focus around which chemicals like cholesterol and things can form. So you may have not too high cholesterol level, but if you have high blood pressure, and you may have deposition of what we call atherosclerotic plaques within the blood vessel. They reduce the amount of blood that flows. But the most important thing is what we call the target organ. The blood that flows through our blood vessels goes to our brain, goes to our eyes, goes to our kidneys, goes to our skin, goes to the penis, goes to the ovaries, etc. So when there is decrease in the amount of blood flow, it is the target organ that damages. That is why in the protocol of monitoring and evaluating hypertensive patients, we do kidney function tests, we do liver function tests, we do cholesterol, because we are looking at target organ damage. So we're looking at diabetes, that is sugar level in the blood. Let's not make a mistake. Sugar is life. Sugar is life. So diabetes is a problem with sugar management, but it is not a sugar problem per se. The issue is that all the cells of the human body needs to be alive, and sugar is the fuel for their living. However, sugar is managed by a set of mechanisms, including what we call the pancreas, that produces a certain chemical we call insulin, and the insulin acts on the sugar so that it will move from the blood vessel into the tissue for your tissue to work well so that you can walk around, etc. Sometimes there's a problem with the insulin, and therefore the sugar cannot move from the blood vessel into the tissue, and the sugar is high in the blood vessel. And this high sugar can affect the blood vessel to make it thick and the insides to become narrow, because the high blood sugar causes the cells within the lining to multiply and grow. And when this happens, in small vessels, they are very significant. The blood vessels are called arteries. They break down to arterioles, and then at the end, before they enter into cells, they are called capillaries. And these are very, very, very tiny. Even you may not even see them under a microscope. So any small change in their diameter makes a difference. So when you have problems of sugar, it can, at the long term, affect your eyes, it can affect your brain, it can affect your heart, and these are the things that leads to the complication. It can affect even your legs, because the blood vessel that supply vessel to the toes and things get problem, and then you can have various changes, numbness, burning sensation. Sometimes you can have blisters occurring on your legs, and some of these things can lead to poor blood supply, circulatory changes, and then some may even finally end up in amputation of the various legs. So we'll be looking at sugar to make sure that we don't get there. Sugar is in the blood vessels, and the blood vessels are everywhere. So it is good that when you are told you have diabetes, you start from the very day go, because most of the time you will not have any complaints until there are complications. So you should start now so that you don't have a problem. And what happens is that when you start having one problem, means there are problems at other areas, maybe at different levels of development. So let's not wait for us to develop problem, because diabetes is actually a blood vessel problem, and the body is a network of blood vessels. The moment you realize that maybe you are having problem with your legs, like some people say, when you get amputation and they cut one leg, then next time they will cut another leg. It is true, because just one leg was faster in developing the problem, but the problem is in all the legs and the hands and the kidneys. So we should be very, very serious with our sugars. What are the acceptable sugar levels? In here, Accra, Ghana, our sugar levels are the old ones. Normal fasting blood sugar when you are not eating is between 3.5 millimole and 6.5 millimole per liter. However, in the first world countries, especially USA, they have now revised their values, and now even if you are not diabetic and your sugar is going beyond 5.5, they already call your attention and start putting you on diet. So I think we should follow something similar, so that at least if you don't have a sugar machine, regularly, at least once in 6 months, once in a year, you should get a sugar check. If you have a family history, either your auntie, your mother is diabetic, at least every 3 months, you should be checking your sugar. And sometimes we are able to detect a possible diabetes before it starts happening. We have 2 types of diabetes, what we call the type 1 diabetes and then the type 2 diabetes. In the old naming system, they were called insulin-dependent diabetes and non-insulin dependent diabetes. And the rationale behind that nomenclature, the naming system, is that in insulin-dependent diabetes, it normally occurs in young people, and those people, they cannot survive without insulin. So very early in their childhood, they are giving insulin before they can be able to survive. Then the non-insulin dependent are the ones that are now called type 2. They don't need insulin. You just give them tablets, and then you are able to control their sugar. It has come out that even the so-called non-insulin dependent, when they live long enough, it gets to a point that they also become dependent, or they need insulin, because we have limits to which the diabetes tablets can be taken. The common ones are the insulin secretagogue, and the common ones are the sulfonylurea, which normally we call the Dardanelles. We have the glibenclamide, the glimepiride, the glycoside, etc. These ones act on the insulin producing cell, the pancreas, and they push the pancreas to push more, like you are sitting on a horse and you whip on the horse, and the horse is moving faster and faster and faster. So when you give those medicines and the sugar is not getting control, you increase the dose, and then more insulin is being produced, then you are getting your control. But it gets to a point that the pancreas gets to its limit. So no matter how much you increase, you will not get any increment again. At that point, you would need insulin. So sometimes you see somebody is taking Dardanelle, metformin, then he goes to the hospital and doctors say, oh, this time we'll have to give you insulin. And at that point, they will stop the ones that pushes the pancreas. They will stop maybe the Dardanelle or the glycoside, and then they put you on insulin. And then somebody, hey, no. Especially when they put people on insulin, they don't keep long and they die. No, it is not true. The body has gone to its limit, and the earlier you accept the insulin, the better. When you accept insulin treatment faster, complications and things don't occur. But most of the time, people want, oh, you waste more. You let me go and come next time, the next visit, we'll see whether it will come. And then sometimes when they are coming to hospital, 2 o'clock, they won't eat again. And that's not what they do. So they will come the following morning and then they appear to have good results. Who are you deceiving? So the earlier you accept insulin, the better. So when the doctor assesses, sometimes we are able to catch people like this by doing a test which call HbA1c, what we call glycated hemoglobin. That gives you the average sugar for the past 3 months up to the day the test was done. So if you take the sugar level today and you do HbA1c, it will give you the average for the past 3 months. So if you have gotten a fasting sugar of about 5.0 today and your HbA1c is high, that means that you were living a very bad lifestyle and you have decided to deceive the doctor. So if you are attending hospital and doctor tells you that he wants to put you on insulin, it is for your own good. So insulin injections need some education, because the least mistake you make, the sugar will drop too low. And there is the risk of something we call hypoglycemia. So it is good to accept it early when your eyes are good, so that you will not need somebody else to be drawing the insulin, because nobody can sit with you. Sometimes somebody feels that his child must accompany him all the time. The young man has to look around, either going for a job, looking after or chasing his girlfriend, or the other way around. So it is good to start looking after yourself early, so that at least your eyes may be good. If there's a need to get visual support like lenses and things, so that they are done early. I think the rest of the things we'll talk when we get on to the question time. So now we moved on to the next question about spondylosis, that is talking about our spine. The whole body is centered around our spine. And the spine has been, intelligently made in such a way that if you support the spine, you will keep yourself upright for practically the rest of your life. When you look at the backbone, which we call the spine, it houses an extension of the brain. And we call it the spinal cord. The body needs to be controlled by electrical wires, which we call the nerves. And the nerves come in the form of a small tube like sausage, but they have wires coming, and these wires pass in between the bones. When you look at the bones at the back, the 31 bones are not sitting on top of each other, one on top of the other, but you realize that one is sitting and shifted slightly to the front, and then it gets to a certain point, and then it goes back. Please, can you give us the previous one? Yeah. When you look at the one on the left, it has an S structure, what you call the sigmoid structure, and this makes sure that the weight of all the 31 bones are not all concentrated at the lower side. And this is the intelligence of the universe, such that the weight of the whole body is not borne by the ones at the lower edges, because the weight is shifted slowly and moves, and muscles are holding them in place. And if you are able to maintain this thing by learning a correct sitting posture and a correct lying posture, your spine will keep you for a long time. Because there we have centers that regulate the organs within the body. For example, we spoke about prostate, we spoke about maybe heart and things. All of these things get their command or their electrical supply from the backbone. So apart from the fact that the backbone will keep you erect, maybe able to walk, etc., the backbone also houses the centers that control the internal organs. So if you learn how to keep the spine well, and also here, learning proper meditation, how to be able to put your attentions on what we call the chakras, the at least 7 chakras and more of the human body, you'll be able to affect the functioning of your internal organs and maintain your health. So I think once we are almost done, I will not go further. The only thing is that we'll look at the pictures, and then I'll tell you that embrace interior mission, embrace health system, embrace the health ministry, and you'll be able to avoid most of the things. Now research is going on. It is not yet conclusive, but everything is pointing to the fact that, good health can be maintained through things like yoga, pranayama, and diet. Thank you very much. So we open the floor for questions.
Thank you very much, doctors. I believe that you are finding this very useful, and I'm taking notes of certain key points they are making. Now it's time for questions. So if you have any questions you want to ask, they are available. And you remember, they are giving you free consultation. They are going to tell you what you need to know for free. So take advantage of it. We have about 20 minutes to do that. So just ask your questions and be brief in your questioning. Thank you.
Thank you. Yes, my question goes to Nadi. My name is David Ado. My question goes to Dr. Nadi. A friend of mine told me, in order to avoid prostate cancer, you need to stop. When you are passing urine, you need to hold the penis for about 5 minutes before you release it. I'm asking if it's a good practice. Thank you.
I'm Makela Provençal. My question goes to Dr. Nadi. Why do we ignore the red flags when it comes to prostate cancer or enlargement? Because my dad had prostate enlargement, and then upon series of tests, we also realized that, or the doctor realized that he also had bladder stones. It went together, and then he had the surgery, and he's fine now. So, because he never complained of any signs, or one day everything stopped, and then we have to rush him. And thanks to Dr. AJ, he recommended a doctor at Kolibu, and everything went on well. Thank you. So, my question is the red flags, and do we see them and ignore them, or we don't at all? Thank you.
Good morning. My name is Kumsi. My question goes to the male doctor. Forgive me, I don't know your name. But what I experience is low blood pressure. I've heard you talk much about high blood pressure, so I want to know what I'm supposed to do and how I should go about it.
God bless you. My name is Augusta Klokai Kwenometo. Dr. Ajay, I just want to know, if you are diabetic, what should the reading be? You are diabetic and you are on medication. What should the reading be? Because it's like you said what your reading, your sugar level should be, but I didn't hear you talk about when you are diabetic and you are on medication, what your reading should be. Thank you.
My name is Biden Anoye Okain. Dr. Eji, I want to ask you some question about the spinal cord. At times, when you are raising your hand, Dr. Eji, I want to ask you something about the spinal cord. At times, when you want to raise your hand to your back, I wanted to ask, because we are growing, that's why our hand cannot go through our back, or you feel a sharp pain. And they have been giving medicine, painkillers. The thing is not stopped, and you feel some sharp pain too under your feet. And all of a sudden, turning your body, you are not feeling well. So please, that's my question. I want to know the reason why. Because formerly, I can use my sponge when I'm bathing to my back, but nowadays I cannot use it. So I wanted to add, because of the age or what? Thank you.
Okay, thank you very much for the questions. The first question is quite interesting. So your friend said you should hold your penis so that you don't get prostate cancer whilst urinating in order to avoid. That's a very interesting question. I think we've spoken about how prostate cancer comes about. It's got nothing to do with how you hold your penis. It's not got nothing to do with urination. I've explained that prostate cancer comes about by DNA changes in the cells. So the cells, like I said, the cells are going in a particular way. Then a group of cells decide to behave in a certain way. And then they multiply in number. And that's what the tumor is. And then it spreads from one place to the other. So, I mean, different people have so many ideas. Like I said, some have ideas about what to eat, what to do. But all these things cannot prevent you from getting prostate cancer. However, what can prevent you from getting prostate cancer is when you do your PSA regularly. And then if you do your regular health checks, and if you have any of the symptoms which I have mentioned, like urgency, incomplete voiding, and all that, when you have those symptoms, you go to the hospital immediately. So that's the answer to the first question. Okay. And the second one was, do we ignore the red flags? Is it possible that someone can have prostate cancer and not have any of these symptoms that I've mentioned? Yes. I mean, remember I mentioned that we have stages. We have stage 1, stage 2, stage 3, stage 4. So stage 1 of prostate cancer, the cancer is localized. It hasn't spread. So it's located in a very small portion. So sometimes cancer might be starting and you wouldn't even know. And it might be an incidental finding. You go to the hospital and it's picked up. And so you may have stage 1 cancer, you don't have any symptoms. But then when it starts spreading, that's when you suddenly have the acute retention of urine, and then you have to be rushed immediately to the hospital. However, there are also those that have the red flags, which I have mentioned. They have all the signs and symptoms, but we know that studies have shown that when it comes to health-seeking behaviors in men, as compared to women, it's reduced. Men would not usually go to the hospital. Studies have actually shown that as compared to men, they would manage it at home. They may have had the symptoms, but don't want to bother anybody, so they just manage it until it gets to the point where they can't handle it anymore. Yeah, thank you. I hope that answers it.
Thank you very much for the wonderful questions, and thank you, Nadia, for your responses. Yeah, the first question, the gentleman was asking about low blood pressure. If we accept what he's saying without rechecking, low blood pressure is very, very uncommon, even though it can occur. And when you get low blood pressure, there are a few measures that we can advise you to do. Normally, we may be asked to take certain medicines that can increase the heart rate, but most of the time we can advise you either to increase your salt intake a little. However, before you accept that you have a low blood pressure, please visit the doctor, because some people have come to me saying that, oh, I have low blood pressure, and the only thing to realize that they have what we call optimal or ideal blood pressure, not low blood pressure, because the blood pressure maybe is around 98 over 60, 100 over 60, 100 over 59, even though the 59 is quote-unquote statistically taken to be slightly low. But once you are asymptomatic means no symptoms, no dizziness, and you are fine, the blood pressure values, quote-unquote, should not worry you. If you have a blood pressure of 90, 95, 100, 105, and you are feeling dizzy, then means that something needs to be done, and you have to see a healthcare worker. Please, do you have an idea of your low blood pressure that you believe you have, sir? You feel tired, and you have ruled out other causes of tiredness, sir. So please, I would advise you to visit a nearby healthcare facility, because tiredness could be due to a lot of things. Maybe you don't have a resting plan and you are working all the time, like now that I am doing. But sometimes it can affect your health. You feel that your life is not complete. Something is not as if you have malaria. Maybe you just need a rest. And then sometimes too, it can depend upon what type of food. Some people, when the fat content of your food becomes too much, it can make you feel sick. And so it could also be sometimes some malaria. Is it what has been happening to you all this while, or just recently? When you eat certain type of food, please take the mic.
When I eat certain types of food,
That's
that's when. So I'm trying to avoid them. But
So when you eat certain types of food,
yeah,
and you measure your pressure, or you don't measure
no,
them.
when I feel dizzy, and I feel and when I go to the pharmacy to check my pressure, I realize that it is low.
Yes. What numbers do they give you, sir?
I've forgotten.
Yeah. Because low blood pressure is okay, but they are very, very, very uncommon. And they are a challenging area in medical practice. Very, very challenging area. But they don't occur most of the time. And we can do a lot of things by excluding other possible causes of that feeling. So maybe you have, maybe you don't have, but please, I advise you to see a healthcare worker so that at least the right thing will be done for you. Then we are talking about diabetes. What should somebody who is a known diabetic on medication, what should his or her sugar levels be? If you are a known diabetic, it is best if your sugar level is like a non-diabetic, which means that it should be between 3.5 and 6.5, or better still, get the ideal value, 5.8, 5.9. If you are using the American system, then your sugar should be around 99, 100 to 106. But within our value, if you get 5.8 or 6, if you want to change into the milligram, you multiply by 18. Because some people, they have people outside who give them machines, maybe from elsewhere, and then they measure in milligram per deciliter. So whatever value you have in milligram per deciliter, you divide by 18, and then you get the minimal equivalent. So if you are a diabetic, and another, what we call monitoring and evaluation tool is what I mentioned to you, what we call the HbA1c, that is the glycated hemoglobin. And the cutoff point is not more than 5.9%. So when you do your HbA1c, when you get to the lab, the doctor will write for you HbA1c to check how good your sugar control is. At least to tell you the previous 3 months up to the day you did the test. So if you get about 5.8, 5.7, it translates to about 6 on average, which means that every day you were getting 5.9 or you were getting 6. So at least that should be able to help you. Sugar level fluctuates. Today, okay, thank you, sir. Today, for example, your sugar can be 6.1. Tomorrow, it can be 6.5. The next day, it can be 5.8. But once it hasn't deviated too much from the between 3.5 to 6.5, it's okay. When you are on medication, it is not advisable for your sugar levels to get close to the 3.5 level, because the chances of you getting hypoglycemia is high. Hypoglycemia is when your sugar level is too low to support the functions of your heart, your respiration, and your body movement. So it will manifest as tiredness, it can manifest as dizziness, sweating, etc., uncomfortable feeling. If you visit the hospital regularly, the doctor should be able to detect either off average readings or below average readings. Because if your sugar levels are normally around 5 and all of a sudden it's gone to 13, there must be a reason. And most of the time, either you have attended some party or something, and if things are absent, then probably there is an infection. When you get maybe toothache, when you get urinary tract infection, something shoots sugar up, or you have overeaten, or you have gone to some party, etc. So when the sugar goes out beyond what it normally be, then the doctor will engage you in a conversation, and if it's something that you have just done, you advise against it. If these things are absent, then they have to look for what is causing, and most of the time, an infection or infestation can cause a derangement in what used to be a stable sugar level. And then the next question is about your inability to raise your hand above a certain level and to send your hand to your back. And spondylosis may be a contributing factor, but not necessarily the cause. When you are getting older, in addition to spondylosis, you can get local changes within the bones of the shoulder, what we call arthritis. Arthritis is common in women, but it can occur in anybody. So it could be due to arthritis. It could also be to spondylosis of the cervical spine. So the best thing to do is to visit a healthcare facility where you'll be made to do X-ray of the spine, X-ray of the shoulders, and then they will find out. Sometimes they will take a history about your lying postures. Sometimes some people lie almost on their side all the time, and it causes disturbed blood supply during sleep. And this thing can go a long way to affect hand movement. But now I can't tell you exactly what the cause is. But the possible inclusion could be arthritis of the joints of the shoulder. It could also be spondylosis. It could be both. I don't think there's anything else. I think that's all.
Hello? Can I make a contribution? Hello? My name is Brother Ishmael Tete. This talk is stirring some passion in me for the youth. I feel very sad that we live life to work hard, make lots of money, and then when we are old, we are not even having the health to enjoy the money. And it all starts from the youth. Saint Togbo Mensah, on quoting him, said, Ethereum mission is the best thing that has happened to Africa. Ethereum mission is total church, and the best thing that has happened to Africa. Because your lifestyle and the many things we're hearing today, Dr. Ajay especially, is telling us the importance of health reset. And so one of the patients is right here. When we started health reset, I was doing it for years. And people always wonder what is keeping him this young, strong, able. We introduced it to the church. It was very welcome. These days, the interest is lowering. Am I right? And for the youth, it's zero. I mean, no matter how hard I try, I will never be young again. And however hard you try, you will be in my age. Whether you will be as strong as me in my age or weaker depends on what you are doing now. So I encourage the youth. Please, your future is what you are creating in your youth. I started some of these programs very, very early. Some of you have known me for more than 20 years. Anybody here who has known me for more than 20 years? Let me see the hands high up. Oh, please keep the hands high up. More than 20 years. Keep the hands still up. Those of you who have known me for more than 20 years. Those of you who know that I wear glasses. Keep the hands up. And all the hands are now down. You are keeping your hand up because I told you. But you've all seen me. You've not seen me wearing glasses. I have glasses for over 30 years. But my eyes are very clear because I exercise even my eyes. North, south, east, west. And then you see north, south, east, west is a whole program. If I'm to teach it, we wouldn't have much time for it. But simply, north, south, east, west, northeast, southeast, northwest, southwest. For just 2 minutes every day. And then we see by light, isn't it? So nature will teach me that once a while, go and look at the sun in the morning when it is rising with your eyes closed. So with my eyes closed, I look at the sun and turn my head slowly to the left and to the right. And we used to be doing these exercises. I believe you still do it in Total Health. You still do, am I right? So we do these things. And the youth, you must come and learn. I don't see youth coming to Total Health. It's as though health belongs to the old ones. The old ones are those who ignore their youth and now they are seeing the need to do something. So why do you also wait to be that wrong and wait till you are old before you start thinking? So I'm inviting the youth. Wake up. So the eye exercise and then bathing my eyes in the sun. I'm also as lazy as you. So sometimes I don't do it for months. When I see my eyes becoming blurred, then I start doing it. I was a computer engineer, having one of the computer industries in this country. So I was training people. So I use computers a lot. And when I face the computer for a long time, then I start having the eyes blur. Then I go back to the sun and start doing my eye exercise. Then my sight is okay. I'm just 70 years young. And I say, I've been having the glasses for how long? Over 30 years. So I use only when sometimes I'm traveling and then it becomes blurred a little bit. Occasionally. In the last year, I've never touched it. With what? Exercise. Just exercise. And then the youth, again, total health reset. And as a way of living, once a week, just fast for 1 day, preceded by warm water enema. The body keeps the food as energy in the fat. And when once a while you don't eat, you enter into what we call ketosis, where the body is now using the stored energy in the fat. And in so doing, it releases also the toxins in the body. I mean, this is simple. If you like, eat all of your food, lifestyle, they are telling us. Eat every day, any food you want. Belief, isn't it? You believe you can have anything you want. And then when you get to my age, you are now weak. So once a week, fasting, preceded by enema. We were doing this, and many of you probably have even forgotten. You're no more doing these things. So exercising. And then, of course, eating junk food. When we are doing health reset is not only for you to do the program for 42 days, but for you to learn that it is important to eat God food and not always just synthetic artificial food. We have food, we cook some, we heat some, we bake some, we roast because we believe God hasn't prepared the food well. At least have some natural food in your diet every day, and we can avoid many of these diseases. Thank you for listening, especially for the youth.
So yeah, I just want to add something to what my dad said. The hypertension. Oh, sorry. The hypertension and what Brother Ishmael said. The hypertension and diabetes. Now it won't wait for you to get to old age. Now it doesn't do that. We have a lot of young patients, children who have diabetes, children who have hypertension. So now the youth are getting hypertension and diabetes. They may not even wait for you to get to your 40s and above anymore. So just to add that, thank you.
Our distinguished medical doctors have taken time off their busy schedules to come and share knowledge and offer free counseling to us. Shall we put our hearts together in thanking them? Dr. Ajay and Dr. Nadi Tete, we thank you so much for always offering yourself to come and give us a health talk. We know next year you will also be available. Thank you so much. God bless you.